Assalamu alaikum. As you all know that we have started a series of lectures which in the respiratory therapy module 1, in which the first few lectures are about the introduction of respiratory therapy, what actually is respiratory therapy, what is the role of a respiratory therapist, what is the scope of a respiratory therapy, and what are the benefits and the work job description of a respiratory therapy. So, today is the second lecture of that module 1, in which we will study the infection control, which is a very important and basic subject. These are all the introductory and basic subjects. We will emphasize on all these. First of all, you should know, as I have already discussed in the previous lecture, that first of all we should all know the basics. What is actually the criteria of how to pursue your education, your post graduate diplomas in different fields. So, respiratory therapy is one of them, and today's lecture is about the infection control. So, we will now start this lecture with the picture showing you the infection control, and which is the slogan is that if you are aware of it, then take care of it. It means that if you, as you can see in the picture, that there is a diseased person lying in the bed, there is a person who is a lady who is a working lady. Similarly, a hand hygiene is showed, and somebody is washing his hand, and along with this somebody is staying at home, and a lady having her kids with her and walking around. These are all the life related daily routines of different people. And similarly, if you are working in a tertiary setup, or if you are working in a healthcare system, so you have to take care of all these, that what actually is infection and how can you control. In certain hospitals in Pakistan, as you know, in certain hospitals we have a infectious disease control department, in which there are a complete set of doctors, nurses, and all the allied health sciences which always guide you and which always update you about the latest guidelines of the infection control, how to prevent control, and how can you keep yourself away from all the diseases which you can acquire while treating people. So, in general overview, an infection control is important in departmental workplaces. This is the general overview slide, in which they say that infection control is important in departmental workplaces. Why? There are specific diseases that can spread easily in our workplaces if controls are not in place, which is a common thing. To protect your own health as well as the health of those around you, an understanding of infectious diseases, how they are spread and how to control them is fundamental. So, this slide provides a general overview of contents of this presentation, in which this presentation provides background information, departmental protocols, what are you expected to know, and what you are expected to do to stop yourself and others from getting sick. And why is this presentation important? Staff are entitled to be aware of the hazards they are potentially exposed to at work, what the controls are, how to implement those controls, and what to do if those controls are not working. As an employer, the department has a duty to advise staff of these potential hazards. In our workplaces, infection and infectious disease are an identified hazard. For example, to promote the discussion, a teacher aide who is required to assist with toileting of students in a special needs environment. Some infection diseases are spread via the fecal-oral route, which is microscopic amount of fecal matters are inadvertently ingested. For example, hepatitis A. This is a common thing. Let me explain it. For example, if in a school the students are attending the toilets and there is no hand hygiene and proper hand washing after using a toilet, it is there are chances of getting an infection which is hepatitis A. So, this is a fecal-oral route. The teacher aide should know. Now, what she should know or he should know, and what is his job to tell the student that who is required to assist with toileting of students in a special needs environment. That hazards, risks, modes of infection, disease transmission and prevention. These are the things that a teacher should know and she should tell the student, or a doctor should know and an infectious control manager should know. So, standard precautions of correct hand washing and the proper way to wash hands. This is a kind of complicated slide, as I have already discussed, that it is a simple thing. After washing your oral, your hand hygiene, you can prevent spread of hepatitis A. The required facilities including the hand basin, running water, soap, paper towels and personal protective equipments, PPEs, for example gloves, and have access to those. So, this is an overview of today's lecture, in which the infection control program is important in departmental workplaces. Now, what actually is infectious diseases? What actually are the infectious diseases? Infectious diseases are diseases you can catch. Humans are susceptible to a wide range of diseases that can be contracted from other people, for example, measles, from insects, for example, mosquitoes, and animals, which is zoonosis, for example, bats, horses and cattle, and the environment. You can acquire a disease from an environment as well, for example, the contaminated water and waste. So, we are talking about all the contagious diseases which can spread to different routes. It could be fecal-oral route, it could be air droplets, it could be syringe prick, etc. So, the most important and related to a respiratory therapy is the air droplet infection. So, you should know that while treating a patient in an ICU or in a hospital, what actually a respiratory therapist should know. He should know that most of the respiratory diseases can spread through the droplets, and you can, if you are aware of all these preventive measures, then you can prevent the spread of all these respiratory diseases as well. So, the Work Health and Safety Act of 2011 recognizes the general duty of the workplace to be safe from harm. The Public Health Act 2005 has a specific section that applies to the powers and responsibilities of providers of services, for example, school principals, to act in the event of a prescribed contagious condition. This is to prevent the particular condition, for example, measles, from spreading through the school and into the community. Hope you are understanding this. The other thing is departmental workplace. Infectious diseases spread easily in our workplaces. Why? Because group of people in a close contact for extended period and on a daily basis, for example, classrooms. In medical, we always say that what actually is overcrowding. Always, if you know what actually is overcrowding, so it will help you that in overcrowding, most of the diseases can spread easily, and they can have a medium for the spread of a disease. So, for example, group of people in close contact for extended periods and on a daily basis, for example, a classrooms, in a school, in a college, in a medical college. Similarly, culture of attendance and even possible contact with asymptomatic carriers, for example, contagious before the symptoms show, and non-vaccinated population and environmental. These are the things that you should be very careful in nowadays, especially post-COVID era. In post-COVID era, you should be very careful of all these 5 basic fundamentals. Hygiene issues is an issue as well. For example, poor cough and sneeze etiquettes, hand washing. If you are not properly hand washing, there is a poor cough or sneezing etiquette. So, there are chances of spreading an infection. Similarly, workplace activities are important. You should know that contact sports, special education and first aid, work duties, for example, cleaning and maintenance and toileting, community engagement, for example, visitors and volunteers, curriculum, for example, handling animals, food preparation and food consumption, science activities. Locations, for example, mosquito-borne diseases, Rose River, dengue, Japanese encephalitis. Now, to explain this a bit, let's see that, for example, a day-to-day activities at a departmental workplace can potentially place us in contact with blood and body fluids. For example, a head clash in the playground or in the sports field, an unwell student that vomits in the classroom. Our schools and other workplace often have others whose immunity and or illness is unknown. For example, at an open day feet conference excursion, or they may have a diagnosed but undisclosed condition, for example, hepatitis C. If you come across a person who is a carrier or who is suffering hepatitis C and you don't know, it can also help in spread of the disease. So, you should be very careful of all this. So, consider some other reasons that a workplace may be an amplifier of a disease. The behaviors, the conditions, the cohort. What actually a cohort is a group of people or a group of or a group of thing you should select for study. And non-vaccinated staff and students, staff or students undergoing cancer treatment or which are immunocompromised. So, how infectious diseases are transmitted? The modes of transmission are different. For example, the one is contact transmission, direct contact with infectious blood or body substances. The droplet transmission, which is the infectious agent in large droplets, for example, the respiratory secretions, splash or splatter. And similarly, let me explain this a bit. For example, the droplet transmission, suppose the patient is admitted in an ICU and you are taking care, and he is underwent a tracheostomy, is having a tracheostomy tube in situ, and you have to take care of all the secretions he is producing on daily basis, and the patient is ventilated. Similarly, there are chances of ventilator associated pneumonias as well. So, you have to take care of all these droplet infections because every day on routine basis you have to suction the patient through that tracheostomy tube to remove all the secretions which he is producing on daily basis. So, while doing this, you have to be careful that you should not contact all these secretions, or sometimes if a person is having tracheostomy tube in situ, he can cough, and while coughing he can throw his sputum on you. These are all the practical things which later on after we will have different lectures on asthma, COPD, and later on in module 2 we will have lectures on the ventilator associated pneumonias, ventilator, and a patient who is admitted in ICU who underwent tracheostomy, and all these things. So, you will come to know that what actually how they can be transmitted from a diseased patient to a healthcare provider. So, similarly, the one contact transmission, the one is contact transmission, in which the direct contact with infectious blood or body substances can happen. The other is droplet transmission, in which the infectious agent in large droplets, for example, the respiratory secretion, splash and splatter. The other is airborne transmission, in which the infectious agent is in aerosols and are inhaled. The foodborne transmission, in which the consumption of contaminated food. Waterborne transmission, in which the consumption of contaminated water. And vector-borne transmission, which is carried by a vector, for example, mosquito bites, etc. The airborne or droplet transmission, as you can see in the picture, that the airborne or droplet transmission, large particles droplets can carry viruses and bacteria through the air, which can be deposited into the mucous membranes, for example, the eye, nose, mouth of a susceptible person, for example, via sneezing, coughing and talking. So, if you are sneezing, coughing or talking, you can be the source of transmitting a disease through respiratory droplets, and you can affect a person in your surrounding. So, you should be careful, you should know the cough etiquettes, you should know the sneezing etiquettes, etc. So, these are the important things. The small particles including for example, aerosols that are airborne which fly in air may also be deposited on mucous membrane or inhaled directly, and these can lead to different diseases including tuberculosis, for example, which is TB, pulmonary tuberculosis, Q fever, Legionella, chickenpox and measles. So, we can prevent all these major diseases by just taking care of ourselves, by just knowing that what actually are the cough etiquettes, what actually are the sneezing etiquettes. So, if you will take care of all this, you can prevent the spread of these diseases. This picture clearly shows how a sneeze will impact on people and surfaces. This is why sneeze and cough etiquettes are very important in the workplace. How could standard precautions address airborne and droplet transmissions? Hand washing to prevent hand to mouth contamination, cleaning and disinfection to prevent indirect transmission, for example, wiping down surfaces, cleaning and disinfecting, chopping boards, respiratory hygiene, cough and sneeze etiquettes are important. So, cover the nose, mouth with disposable single use tissue. You can cover the nose, mouth with disposable single use tissues when coughing, sneezing, wiping and blowing nose. Use tissues to contain respiratory secretions. Dispose of tissues in the nearest waste receptacle or bin after use. If no tissues are available, cough or sneeze into the inner elbow rather than the hand. It means that if you are coughing or sneezing, you should put yourself here. If it is not possible, you can use your arm as well. And similarly, practice hand hygiene after contact with respiratory secretions and contaminated objects and material, which is the material, wash and sanitize. If no tissues, coughing or sneezing into your sleeves. Now, these are all the cough etiquettes you should know, and this will help in prevention of all these diseases. These are the small steps if you can take, it can help you prevent the spread of all these diseases. Now, let us discuss a bit about the Q fever, which is primarily transmitted from the animals to humans via inhalation of Q fever bacteria. Would hand washing be the most effective control? No. The most effective control would be elimination. Do not expose unvaccinated people to high risk activity. Vaccination, PPEs, which are the personal protective equipments, level 2 respirator, etc., that is control the protect of mode of transmission of inhalation, like a smoke particle. If you can smell it, then you can inhale it. Q fever bacteria are microscopic. So, the contact transmission include direct contact, in which when the blood or blood substances from a person or animal come in direct contact with another person in such a way that it can enter their body, For example, infected blood or other bodily fluid enters another person's system directly via a wound or via mucous membrane. For example, needle stick injury, which is a simple syringe prick or a needle stick injury. Disease pass from mother to fetus and the saliva exchange. For example, infected blood or other body fluids from an animal enters another person's system via a wound or via mucous membrane. For example, bait, Lisa virus, scratch bite, Rose river virus and mosquito. The direct The contact transmission also include indirect contact. The indirect contact include when germs from an infected person or other sources are passively transmitted to another person, for example, via an inanimate object. Inanimate object including the surface, keyboards, mouse, telephones, iPad, utensils, cup, toothbrush, razors, etc. For example, if you are using these on daily basis and you don't take care of this for hygiene, then it can be the source of spreading an infection. Now, the direct contact is when a person is exposed to an infection agent from direct contact with infectious blood or body substances, for example, blood, urine, feces, saliva, nasal secretions, or from indirect contact with contaminated items such as surface and equipments. Infectious agents can then enter the person's body via broken skin, for example, cuts, the mucous membranes of the person's eye, nose or mouth by ingestion, for example, the fecal oral route, or by a sharp needle stick injury. These are the very basic things as a healthcare practitioner or a allied healthcare practitioner you should know. These are the basic things. So, similarly indirect contact transmission is why it is important to practice regular hand and respiratory hygiene, cleaning and disinfection of contaminated surfaces, washing of linen, sheets, blankets in first aid room, using disposable items when appropriate, for example, tissues, paper, hand towels, and the cleaning, sanitizing of reusable items that may harbor infectious diseases, for example, class sets of recorders, communal cutlery, coffee cups, shared headsets, etc. And similarly, the controlling infectious diseases requires a multifaceted approach considering the modes of transmission, evolving diseases and germ resistance, people's behavior, knowledge and belief, environment where we work, learn and play, changing circumstances and emergencies, individual requirements and group requirements. So, these are the information provided so far should increase awareness of potential diseases in the workplace and how they can be transmitted. It should also increase the awareness that there are many unknowns. An infectious disease could enter the workplace at any time. The workplace needs a consistent, continuous process to account for the ever-present risk and the things that are unable to be controlled, for example, new diseases, people's behavior. The infection control program have key elements of an effective infection control program, including the standard precautions, the immunization and vaccination, the waste management, cleaning and disinfection, the safe use of sharps, for example, syringes, blades, surgical blades, etc. The personal protective equipments, how to use, some of you may know donning and doffing. These are the important things, and hand respiratory hygiene, which is important, training recorded in which you will attend multiple seminars on the infection control program. So, if you can say this is the summary of the whole program, if you know all these slides, including the standard precautions, immunization and vaccination. Immunization and vaccination is very important because this is a kind of protection. This will protect from multiple diseases. So, everybody should be immunized. For example, somebody is working in a setup, he should be vaccinated with hepatitis B. So, if he come across any needle prick injury, he will be a kind of safe. Similarly, you should know what actually is waste management. You should know that you should have a sharp container with different color. You should have a the soft materials you can dispose of in a different container, and you should know a bit about incineration, etc. Cleaning and disinfection is very important through multiple cleaning agents, and safe use of sharps is important. This is a very important slide. So, in order to cater for the gambit of infectious diseases not only acquired from humans, but also potentially acquired from animal zoonoses, the infection control program needs to be multifaceted with all components working in a complementary manner. So, how to implement infection control? Promote infection control as a standard practice. Know the risk in your workplace, how diseases are transmitted, and how to implement controls. Have processes and protocols in place, have appropriate facilities and consumables, allocate funds. Signage, for example, correct hand washing technique, provide and take part in training sessions, maintain record of training, promote vaccination, adopt a risk management approach to infection control. These are the multiple steps. If you know these steps and you can work on this, it can help prevent, and it can develop a social awareness and can aware people of all the control, how to control the infection in the society. So, the protocol for managing infection diseases include, if a staff or student or parent advises of an infectious disease, number one is maintain confidentiality. You should, for example, somebody is suffering a disease, so you should keep the or maintain the confidentiality, but inform the appropriate person at your location. For example, the hospital administration, the workplace manager, you can inform him or her. The second thing is actions for the hospital or the school administration is that determine the nature of the disease, measles, chickenpox, etc. If it is measles, if it is chickenpox, the other thing is confirmed diagnosis, that is was the disease diagnosed by a doctor. If confirmed by a doctor, seek relevant information from the concerned healthcare department, and when confirmed, the school or the hospital may provide information to the staff community to be aware of symptoms and record recommended actions, for example, using a link to a Queensland or the respective hospital. Prevention of spread of infection, in which the important thing is hand washing. Hand washing is one of the most important measures in preventing the transmission of a disease. They say that if you are dealing with a patient who is diseased, who is admitted in the hospital, and you are examining him and you are taking care of him, whenever you come close to the patient, you should have a very good hand hygiene, you should sanitize it, and you should use proper gloves, and after going out of the room, you should again sanitize. By doing this, your hand and washing your hand, by doing this, you can decrease the chances of spreading of the infection up to 25 to 30%. So, hand washing is a very important thing. So, hands should be washed using soap, water, and then dried before handling, prepare or eating food, or before dealing with the patient, after dealing with the patient, contact with blood or body fluids, removal of protective gloves and using the toilet, and after contact with animals. All after doing all these things, you should wash hands regularly. Similarly, vaccination is very important. Vaccine is not mandatory for the staff or students of the department, but this is mandatory for everyone, just not for the students or the staff, but this is mandatory for every person of the hospital. However, a vaccination exists. This is the highest order of protection from the infectious disease. Vaccination boosts the immune system and creates immunity that protects from an infection without causing the suffering of the disease itself. Most vaccines contain a little bit of the disease germ that is weak or dead. Vaccine do not contain the type of germ that make you sick. So, getting the vaccine is a much safer way to make antibodies without having to suffer the disease itself. Occupation specific vaccination is very important. For example, the recommended vaccination for the person who work with children or who work in hospital, including the influenza, the MMR, the pertussis and the varicella. Staff working in early childhood they all need to have a hepatitis A or B vaccine as well. The prescribed contagious conditions as defined by the Queensland Public Health 2005 Chapter 5 Part 2, the chicken pox, varicella, the diphtheria, enterovirus, gastroenteritis, German measles, human influenza virus, type B, hepatitis A, influenza, measles, meningococcal diseases, poliomyelitis, typhoid and paratyphoid, and tuberculosis and the whooping cough. These all vaccinations are important. So, the protocol for prescribed contagious conditions, including the Health Act 2005, children in prescribed condition should not attend school or health care until well and non-infectious. Unvaccinated people may need to stay away during measles outbreak if they are at risk of infection or infecting others. So, if a staff member contacts a work caused serious illness as defined by work health and safety legislation, this is to be notified to workplace health and safety of the department. Some of the diseases related to pregnancy are also discussed in this lecture, including the infectious diseases that can impact on pregnancy. For example, the measles, the mumps, rubella, influenza, chicken pox, and cytomegalovirus and parvovirus can affect the pregnancy. So, those considering pregnancy or who are pregnant should tell the doctor about their work requirements, seek advice about the recommended vaccination and precautions, and know your immunization status. The key responsibilities a healthcare practitioner should know that review your immunization record. If you don't have any, consider a blood test to confirm your existing immunization status. You may find you need a booster. Keep this information handy. So, stay home when unwell. So, staff are expected to model appropriate behavior and stay home when they are unwell or infectious. Promote the follow standard precautions of infection control as well. These are the important things. For example, somebody is having a serious illness, he should inform the concerned authority and then he should inform the administration of the hospital and he should stay at home. As you all know that we are living in post COVID era, so everybody somehow has seen all these things. So, you should apply all these practically, because these are all the basic things. When you personally go through it, you will understand that what actually the infectious control and how can we prevent different diseases by keeping ourselves away or taking few small steps. Similarly, your responsibility include the prevent of the spread of the infectious diseases. Understand and adhere the procedure, infectious control and the infection control guidelines. You should know, understand and adhere to procedure, the management of prescribed contagious conditions, implement and follow an infection control program that has been developed for your workplace. Seek advice always if you required. Pandemic planning is very important. For example, lately you know that COVID has already changed the whole scenario of the world, has changed the globally, every person affected in the past few years from COVID. So, if there is any pandemic, you should have planning for that. The interdepartmental protocols are in place for managing a pandemic or health threat. So, whatever you are getting from the government or the hospital administration, you should be responsible for this. The take home message from this is that workplace may harbor infectious diseases. There is relevant legislation of the Act 2011 and 2005 there are departmental procedures and guidelines to follow: infection control, management of prescribed contagious conditions, prevent the spread of infectious diseases following an infection control program, including standard precautions. Be aware of your own immunity status to common infectious diseases, and some infectious diseases can be harmful during pregnancy. Seek advice if required. So, though through viewing the presentation and assessing further information such as the procedure and the guidelines, it is hoped that you will be armed with and understand the above take home message. I hope so. If you have question, you can later on ask, and thank you. So, this was the second lecture, which is a very basic one, and this is the part of the series of lectures that we have started before. This is the second one. Later on in the coming weeks, we will have different lectures on the main respiratory therapy, including the asthma, the diseases, including the COPD, and including all the other diseases. So, week by week we will share a schedule with you people, and you will come to know that which week we have different, each week we have different classes and different teachers are assigned for this. So, hope you enjoyed this. I will share this all PPT with you. You should go through it and you should study by yourself, and you will come to know that what actually, how can we manage and control infection through our community, through our society, in the society, how can we manage all these things. So, this is all from today. Thank you, and hope to see you again in another lecture. Thank you.